Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or the guests are their own. Enjoy the show.
Hi, I want to welcome everyone to the MS&Me Radio Network. You can connect with us on msme.airtime.pro, and within 24 hours after the broadcast, this will be up on YouTube for you to reach at your convenience. My name is Kelly Alderson. I'm a wife, I'm a mom, I'm a health coach, I'm an entrepreneur and an author. My book, Waking Up from MS, My Journey to Health, Healing, and Living Symptom-Free, is available on Amazon, and that details my 30-year journey living with and beating MS naturally. I want to welcome everyone to the call today. I'm so excited to have my next guest on because I've been following on YouTube and on Facebook and really getting all the information about her own journey with MS. And for those of you who know me and follow my broadcast, I'm all about health, healing, and natural therapies to beating MS. And my guest, Claudia Domene, has done exactly that. Anna, thank you so much for joining us on the call today.
Hi, Kelly. Good morning. I'm happy to be here.
I am so excited. Like I said, I've kind of been stalking you a little bit out there on YouTube and watching your videos because I do have a lot of friends now that are checking out this therapy that you're doing on your journey with MS. But first, before we get into what you're doing now, Anna, could you please share with us about your diagnosis, how you found out about your MS and your treatments you were doing?
Yes, so I am from Brazil, Kelly, and I came to the U.S. 20 years ago, and 10 years ago I was diagnosed with MS. It was in the beginning of 2008. So the way it started, I woke up one morning with both my feet tingling, and I was not very concerned in the beginning. I thought maybe I had exercised too much in the gym the day before. But as the day went by, the tingling just climbed up my legs and all the way up to my neck. So that's when I went to the hospital and started doing all the tests. And then it took about 4 weeks until I got my final diagnosis, which was multiple sclerosis. And in those 4 weeks that it took me to get the diagnosis, I got very sick. Like, I got much worse. I developed a fatigue, very terrible fatigue, like where it was hard for me even to stand up. I didn't need to move or do any exercise, anything. Just having to support my weight was exhausting to me, that if I stood up for about 5 to 10 minutes, I'd have to lay down for a couple hours. I also lost control of my right arm, motor control, mainly on my wrist and my hand, but my whole arm. And I developed a weakness on my left leg. So it was very aggressive, the first flare-up, and it made me very sick very fast. And once I got my diagnosis, the neurologist recommended that I start taking a disease-modifying drug, which was Copaxone. And at that time, I really didn't know enough to refuse the medication, and so I started taking Copaxone. But at the same time, I started researching online. There were already some groups and some websites that talked about alternative options for patients with MS, like of healthy lifestyles, healthy diets, taking supplements. And so I started reading a lot about that, and I started one of the diets that were recommended. And with the diet, they also recommended some supplements. And one of the supplements was vitamin D. And at the time, it was 5,000 units a day. I started taking it. And so I became really interested on vitamin D because even at that time, 10 years ago, there were already hundreds, if not thousands of studies about the connection of vitamin D with MS and other autoimmune diseases too. So I started reading all the studies I could find, and I really became convinced that vitamin D was something very important for people with MS. And then I found in some of the groups, I found some people that they were already taking 10,000 units a day. And I remember that there was one patient that was taking 15,000 units a day. They had increased their dose on their own. And the ones that were taking higher doses reported that they were feeling really well. And so I was considering increasing my dose to 10,000 units a day when, by coincidence, which I always say it's not really a coincidence, it is because I was really searching for an answer, and I think the answer came to me even faster than I could imagine. But at the time, I found out that a friend of mine from Brazil, a friend of mine from college, with whom I had not spoken for a few years, she also had MS, and she was doing a treatment with a Brazilian neurologist that recommended high doses of vitamin D. The whole treatment was based on high doses of vitamin D, and she was doing very well. So I immediately got in contact with her, talked to her, and at the time she had been on this treatment for 4 years, and she just told me that her MS had gone into remission. She had already stopped taking the conventional drugs she was taking before, and she was having a completely normal life with the treatment. And it was all based on high dose of vitamin D. So because I had already researched it, I was reading so much, and I was already so convinced that vitamin D was very important, I immediately called her doctor, which is Dr. Cicero Coimbra. He's a Brazilian neurologist, and he is the neurologist that created the Coimbra protocol, which is this treatment that uses high doses of vitamin D for autoimmune diseases. So I called him, and I made an appointment with him, and as soon as I could, I went to Brazil and had my appointment, and started following the Coimbra protocol and taking high doses of vitamin D.
Now, Anna, let's talk about what were you doing? So you decided to go on the vitamin D protocol. What was your neurologist back here saying about that new protocol and the steps you were going to take? Because at that time you were on the Copaxone. What was your neurologist directing you to do?
Yeah, so when I told her, she told me that as long as I did not stop Copaxone, she was not going to forbid me to take vitamin D, the high dose of vitamin D. So, and I was not planning on stopping Copaxone because at that time I think I was not completely aware of all the terrible side effects that medication could have. And I really thought I was protecting myself from all sides, with the healthy diet, with the vitamin D, and with the medication. So because I was not going to stop the medication, she told me that I could take vitamin D, but she also told me that she didn't believe it was going to help. She told me I'd probably be wasting my money on vitamins. That was her opinion. But at least she did not create any problems for me to do the protocol. And at that time, I had my primary care doctor, and he was wonderful. He was very supportive from the beginning because in this protocol, we need to take regular lab tests. We need to do blood tests and urine tests. And so since Dr. Coimbra is from Brazil, he could not order my tests here in the U.S. In my primary care here, as soon as I told him about this treatment, he said he agreed with me that he thought vitamin D was something that we would still learn a lot about it, but was something very important, that he thought I was, making the right choice, and that he would order all the tests that I need for me. And he has been with me for those 10 years, and he still orders all my tests, so he's been always very supportive. So that made it easier. Yeah, that made it easier for me.
That is so great that you had at least him on board with you. Your neurologist wasn't on board. But what's interesting about it, too, is when we have our neurologist just wanting us to go with the disease-modifying therapies and telling us that, a healthy diet won't help, supplements won't help, exercise won't help, but we know too much right now. If your doctor is telling you that, then perhaps you should start looking at a doctor who's going to be in line with your healing, because what we do know about the disease-modifying therapies is that they constantly suppress our immune system. And in most cases, their side effects are even more devastating than what an MS, a flare-up could be, if you will. So really search out doctors that are going to be on the same wavelength with you as far as really looking for your healing, not just disease management, but healing your body. Because I've always been, saying, for these past few years that we weren't born with MS. There's something off in our body, and we just have to figure out what it is so we can start to heal. And
exactly.
It's not there for healing, not getting to the root cause of the issue. It's kind of, just suppressing the immune system. And if our immune system isn't functioning properly, how can we ever be healthy? So you got on this protocol, Anna, and just kind of ran with it. Can you share, I know they have the special labs and everything, and I know a lot of people are thinking that the biggest test that you do on this protocol would be your vitamin D levels, but that's really not the case here. Can you explain a little bit about some of the testing in this protocol?
Yes, and that's very important because a lot of people, they are scared of the protocol because of the high doses of vitamin D, because their doctors say that vitamin D is toxic. Mm-hmm. And that's not true. Like, vitamin D is not toxic. What is toxic is calcium. So when you take high doses of vitamin D, what happens is that this makes your intestines a lot more effective in absorbing calcium. So you can have an excess of calcium if you are not careful with your diet, and calcium is very toxic. But this treatment is very safe because it's really easy to avoid this problem, and that's why we do all the lab tests. And what we do is we follow a specific diet which restricts calcium-rich foods, and we also do lab tests to make sure that the calcium levels are okay on the blood and in our urine. So, like, even if we're eating a little bit more calcium than we should, we're not going to have any problems because the tests will detect before you can develop any serious problems. So that's why this treatment is so safe. And but the tests we need to do, they are mostly the vitamin D levels, they are the calcium levels. We measure kidney function, liver function, thyroid function, just to make sure that everything is fine. We also do tests for bone density, because one of the side effects of this treatment is that you can have a loss of bone if you don't exercise or don't take enough magnesium. So there are ways to avoid that too, but we check that to make sure that everything is fine. So all those tests we need to take regularly. So I take every 6 months. So that's why this treatment can only be done with a doctor's supervision, because he will order the test, and also with a doctor that knows what he's doing in case you have any problems or any of the results is not within the normal range, and so the doctor know how to correct this. But Kelly, what I just want to compliment about my neurologist, that I also have the same neurologist all those 10 years. And since she has been with me from the beginning, she has seen my results, and so now she tells me just to keep doing what I am doing. Yes, and I stopped Copaxone 8 years ago. I took Copaxone for 2 years, and then it did give me side effects. It affected my heart rate. It gave me chest tightening, and I stopped it. And so for the last 8 years, I have only been with vitamin D. And now, because she sees my MRI, she sees my results, she tells me to keep doing what I'm doing,
Anna, let's talk about that. So I'm so glad that she's now on board, because she's seeing what's happening, really a transformation with the Columbia protocol. And we must mention that the Columbia protocol has a 95% success rate. That's incredible. They cannot tell us that about a DMD therapy that suppresses our immune system. They're not getting that kind of result.
Yes.
The DMDs, and remember, the DMDs are not dealing with the root cause of the issues, like the disease-modifying drugs that they keep prescribing to us, right? And the vitamin D protocol is the one thing that is about getting to root cause of the issue. And with a 95% success rate, people really just have to look at this and decide for themselves. I mean, like you said, there's enough information out there where you can search on your own and find out, is this going to be the protocol for you? Now, Anna, let's talk about your MRIs. Let's talk about the diagnosis MRI compared to where your MRI is at today, because that is kind of the standard that people in the MS community use for how well we're doing, right, is what's going on with the MRIs.
Yes. Now, before I tell you about my MRIs, let me just complement a little bit. The 95%, most people in this protocol really have great success with it. And the goal of the protocol is to halt the disease progression, to stop the progression. Now, like some of the disabilities that you may have acquired before, if they're recent, 1 to 2 years old, you can still reverse it. But some of the older disabilities, maybe you won't reverse it. But the main goal is to stop the progression of the disease. And really, there's a 95% rate of success for stopping disease progression in the protocol. And Kelly, if you think about it, vitamin D, it's named wrong, right? Vitamin D is not a vitamin.
Right.
It's a hormone, and Dr. Coimbra now says it's even more than a hormone, because every cell in our body has receptors for vitamin D. Mm-hmm. So what vitamin D is, it's a very powerful immunomodulator. So, I mean, it's one of the most important substances for our immune system. So if you think about it, as you said, the disease-modifying drugs, they suppress the immune system. Mm-hmm. And, of course, with time, it probably causes so much damage to your health. Mm-hmm. But when you take vitamin D in the correct doses, which for us it's high doses, because usually patients with autoimmune diseases, they have a resistance to vitamin D, and that's why we need higher doses than most people. So when you take in the doses that are correct for you, it's going to modulate your immune system. It's not going to suppress. Usually your immune system is going to get stronger. People on the protocol, they feel they don't get that many colds or flus. Their immune system is stronger, but it's not attacking their own body anymore. Mm-hmm. So that's the difference between vitamin D and the drugs. One is an immune suppressant, and the other one is a natural immunomodulator. So that's a huge difference. And for me, when I was diagnosed, I had, in my brain, not that many. I had about 4 or 5 small lesions, but my biggest problem was I had a huge lesion on my spinal cord between C2 and C3. I had a 1.6 centimeter lesion, and that's what really caused all my symptoms, and that's why all my symptoms were from the neck down, because that was the lesion that was giving me problems. Mm-hmm. So with time, it's been now 10 years, and I've had, my lesions in my brain are still there, but just as scars. So I have had no new lesions, and the lesion on my spinal cord, after 2013, and here's an interesting fact, because when I started the protocol, I started with 25,000 units. The doses have increased lately, the last few years, and then in 2013, my dose increased to 50,000 units a day. Mm-hmm. And since 2013, my MRI showed that the lesion is shrinking.
Wow.
So the myelin is starting to grow again. And there has been recent studies that show that vitamin D helps to rebuild myelin. And I thought this was very interesting, because from 2008 to 2013, it just stayed the same. But once my dose increased to 50,000 units a day, then the myelin starts growing again. So, so my lesion now has 1.4 centimeters, which it's a very small. It shrunk a little bit, wow. But I mean, at least it's shrinking. Right. And I have had no new lesions. So like in those 10 years with MS, I've had no new lesions. I don't have any brain atrophy, which my neurologist said is very uncommon with somebody with MS for 10 years or my age. I'll be turning 50 in a couple of months. And I've had no more problems with MS, no more problems at all. Like most of the problems I had at the time of my relapse, they disappeared. I still have a little bit of a different feeling on my hands that never went away. And that's it. Everything else reversed, everything else disappeared. And in those 10 years, I've had no more problems with MS. So I'm very happy with this treatment, because besides not having problems with MS, I feel very relieved that I don't have to deal with problems with the drugs and the side
Sure.
effects of the drugs. So, yes, I mean, I feel like this treatment is so benign. The vitamin D probably helps me with other areas in my health, not only MS. And I don't have side effects. So it's just, what else can I ask at this point, right?
Right. And you know what? The great point that you said was that your body is repairing, that myelin sheath is repairing,
Mm-hmm.
because many doctors, I know of several that people that have been very close with me, their doctor said, you can't rebuild the myelin, you cannot heal and repair that, but we can, and we know this. And we know specifically with doses of vitamin D, you can do that. There's other ways to do it as well with certain foods and supplements and things like that.
Yes.
But your body was made to heal. Our bodies were made to heal and repair. And so that's what you are seeing firsthand. And that's what is so exciting about this is your transformation. You said you're feeling stronger and healthier, and even with your progression just stopping and having no atrophy, which of course is a big problem for people on this journey. Now,
Yes.
Anna, if someone would like to reach out to you because you did write an amazing book, Multiple Sclerosis and Loss of Vitamin D, that's available on Amazon. Can you talk to people about your book? Is that the easiest way to connect with you, or can they get to you through Facebook, or how can they get in touch with you? Because I know they're going to want some more information about your awesome story and this journey you're on.
Yes, so the book is on Amazon. It's on paperback, and it's also available on Kindle. So on Amazon, I do have an author's page. They can get in contact with me through Amazon, but they can also find me on Facebook. And for that, the best thing to do is there's a website, which is www.coimbraprotocol.com. And in this website, besides having all the basic information of the protocol, there are a lot of very useful links. So links to Facebook groups, Facebook page, links to Dr. Coimbra's interviews, and also links to the updated list of doctors that we have, the doctors around the world that prescribe the protocol. Every time there's a new doctor, we update the list. So on this website, you can find all the links and all the information you need. And on the Facebook groups that the links are on the website, you can find me. You can find me there.
Now, Anna, if someone listens to our broadcast today and decides, wow, I have to go and start this Coimbra's protocol, what's the first step you recommend them doing? Should they go to their doctor first? Should they check out the website first? What would be that first step you would recommend they take?
I would recommend that they find the Facebook groups, and it's very easy to find Facebook groups. There's tons of groups in all languages, and all they need to do is put Coimbra Protocol on Facebook, and they'll find the groups in there. And I would advise them to get in the groups and talk to the patients that are already on the protocol. Mm-hmm. And also in the groups, you can also find the link to the list of doctors, and then you can ask the patients that are there for doctor reference. And so that'll be the easiest way to start. Or on the website that I also told you, the www.coimbraprotocol.com, you can go straight to the list of doctors and then contact any doctor in your country there, and you can go from there. And even if you don't have a doctor in your country, there are doctors that do Skype consultations, and then if you get your own doctor, like I got my primary care doctor to support you and ask the tests, then that's all you need. You just need somebody to supervise your treatment, and then you need somebody in your hometown to order the tests you're going to need, and then you're ready to start the protocol. But I would really recommend that they join the Facebook groups because they can exchange experience with the patients already on the protocol, and that'll help a lot.
Yeah, having that firsthand account is so important. And,
yes.
And I want to thank you so much for being on the call today, and I hope we can have you on another broadcast because I know we're going to have a lot of questions, and I like to just have this information out there because what a great way for us to deal with MS, a 95% success rate. I want to really thank everyone for listening in today. And again, you can check out Anna on Facebook or her book on Amazon and really take time to understand the different ways that you can deal with and beat MS, because there's lots of different ways to do that, and I like sharing this every week with you. So thank you so much for joining us today. If you want to connect with me personally, you can check out Kelly Alderson at Facebook or Waking Up from MS on Facebook, because I'm really interested in learning about your own journey with MS and how we're all here together in this battle, and I know you guys can do this. And so just remember, live in hope, focus on healing. And Anna, thank you so much for being on the broadcast today.
Thank you so much, Kelly. It was a pleasure talking to you. Thank you.
Have a great day. Bye-bye.
You too. Bye-bye.